So hello everyone. We're here again today with Dr. Tatiana Havryliuk talking about portable ultrasound or point-of-care ultrasound. And today we're talking about AAA diagnosis at the bedside, how primary care can use POCUS for life-saving screening. So
Yeah, well, specifically for AAA, there are specific indications of when you do, for example, order an abdominal aorta ultrasound, and it's on male patients over 65 who are smokers or have any kind of risk factors for AAA. And in this case here that we're discussing, that I submitted an article for SMA News in the past, it was a 68-year-old male who is a smoker, and he has history of hypertension, but he doesn't really follow up with doctors. So this was his kind of first visit with a primary care doctor in the last 5 years. And he wasn't having really any symptoms. He was found to be a bit hypertensive on exam, and the physician realized that he met the criteria for this screening, and knowing that the patient is not very likely to go and get imaging on his own, even if they
yeah,
order it, they're like, well, why don't we do it right now and just take a look? And this screening ended up uncovering a 6 centimeter abdominal aortic aneurysm, which is really actually uh, this big enough to require surgical intervention. This is not something you're watching and see how it develops. This is pretty much a ticking bomb, right? So you want to repair it before it ruptures. So because of that screening, the patient was able to get expedited CAT scan, expedited vascular evaluation, and then eventually, surgery for this case.
wow. So walk us through just sort of the steps and techniques for performing that.
Yeah, so for abdominal aorta, you would want to use a curvilinear probe, which is a low frequency probe that allows for penetration into the abdomen. Ideally, you want the patient to be fasting. Honestly, I come from the emergency medicine world, and no one fasts in the emergency medicine world. So we perform it on non-fasting patients. But basically, you are getting 4 transverse views of the aorta, so starting from subxiphoid process down to just around the umbilicus, where it bifurcates into the iliac arteries. And then you're getting one or two transverse views as well of the aorta. And you're measuring the diameter of the aorta from outer to outer wall. And the cutoff is 3 centimeters. If it's less than 3 centimeters, it's not aneurysmal. If it's more than 3 centimeters, it is considered aneurysmal. And the iliacs, the cutoff is 1.5 centimeters for each iliac artery. And then another thing you can look for, I mean, it would be for patients usually who are symptomatic, is you can look for aortic dissection as well with POCUS, but that wouldn't be a screening indication.
So how's the evidence support POCUS for this type of screening?
Oh,
The
it,
implication of
I
it.
mean, I don't have specific evidence on this screening part, but in terms of how good is POCUS at picking up aneurysms, abdominal aneurysms, very good, like 98%
Yeah.
sensitivity, 98% specificity. I think the challenge that comes with it is if you're not getting good views, right? So say someone does have a lot of bowel gas, so that requires some technique and patience to be able to get those views that you want. So it does take some operator kind of experience and skill to get consistent views. Also, in very obese patients, it might be difficult to visualize aorta. So I would say if you're not getting good views and you're not trusting your exam at the moment, that's the time when you do order a confirmatory test.
Yeah, yeah, and that makes sense. And it's urgent if you can find that for sure. So talk a little bit about as we usually do, this sort of documentation and coding for this for the reimbursement part.
Yeah, so once again, you need to have an indication, and if this was performed for screening purposes, you might need to get a prior authorization from insurance, depending what kind of agreements you have with your payers. But still, you need to have that indication that the patient met to qualify for the screening. And then your procedure note, it needs to have the views you obtained, your findings, and a final impression, and obviously who performed it, and the timestamp as well. And once again, abdominal aorta screening comes, not screening, abdominal aorta ultrasound comes with its own CPT code, and actually screening for abdominal aneurysm also has a CPT code, so there's a bit of a choice of which one to use as well.
Yeah. And I think in a case like this, with a patient that doesn't typically come back for follow-up, prior authorization might not be as important as going ahead and doing the scan and just trying to code for it anyway. Yeah.
Totally. And I think most of the providers would agree they want to do the best for the patient, even if they might not get reimbursed. You know, if you have someone in front of you who are you concerned about doing a little extra, and honestly, it's not more than 5 minutes. You know, it's not
Exactly.
like you're spending a ton of time, but if you're getting some information, and it could be really life-saving in this case, it's really worth it.
So yeah, absolutely. Yeah, this seems in one of those instances where just do what you have to do. No, this very interesting. Anything you'd like to add to this case?
I would like to also invite the clinicians who are listening to see what other indications there are to do this kind of exam. So this was done for screening purposes, but imagine a patient who comes in maybe with some mild flank pain or abdominal discomfort, and you might order a CAT scan for them and they might not get it for the next 2 days. It might be a non-emergent CAT scan because they're looking pretty good. But those are the patients, if they are elderly, I would consider throwing a probe on and being like, well, at least I'm going to make sure there's not a 10-centimeter aneurysm that's about to burst, and I send them for, you know, a CAT scan that's 2 days from now. So I think that's another good indication to take a look
Yeah,
at the aorta.
5 minutes, right?
Mm-hmm. Yeah.
Okay. Excellent. Another great case. Thank you very much.
Thank you, Randy. Looking forward to the next time.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.